Okay, so today we're going to be talking about the second half of the psychopathology introductory lesson. So we're still talking about abnormality, we're still talking about all the different definitions of abnormality, but today we're going to be doing a little bit of evaluation on them. So if you haven't already had a look at the first set of slides, I recommend you go back, have a look at those and have a go at doing the different activities within them, because that's really going to help you out when we go back through these, because we're only going to go through the definitions of these quite briefly and focus mainly on the evaluation. The other thing about this lesson is that there's quite a few video links, so I'm not going to be able to play those for you while I'm talking about through this lecture. So make sure you pause, you stop and you have a look at those at the relevant points, because they will help your understanding of the psychopathology topic. So main thing that we're going to be talking about are the different definitions, so it might be worth just trying to refresh your brain a little bit. Any three things you can recall from the last lesson, how are they relevant? Just trying to wake your brain up a bit, and if you can't remember anything, I would maybe stop this lecture right now and go back and have a little look, just to kind of refresh your brain and make sure you're ready to learn with this new material. So learning outcomes, hopefully by the end of this you're going to still be able to name and describe the 4 definitions of abnormality, that we're going to apply these definitions to real life examples, because that's kind of what we do in psychology, and we're going to evaluate the strengths and the weaknesses of these definitions. Some of these are a little bit bigger than others, some of them are a little bit more detailed than others. So yeah, some of the definitions are a little bit more controversial than others. So we're going to evaluate these. So some of these you might not agree with, some of these you might take issue with, but it's okay. This is kind of what we're here for in psychology. Like, we're okay to discuss these things. We're okay to see how other people think and what other people think. So as long as we can do this in a calm and rational way, then, you know, we are making progress in that respect. So the different definitions that we've already covered are deviation from social norms, the failure to function adequately, deviation from ideal mental health, and statistical infrequency. And it is really, really important to get the wording of these correct, because if you say deviation from statistical frequency, that's not correct. So it's really important to make sure that you are using the correct wording and the correct labelling for these. So we're going to start with deviation from social norms. Just a reminder that this is defined as behaviour which violates accepted social rules. This is the definition of abnormality where it's actually really easy to spot when someone is not following the social norms, someone is not following the social rules. But it's much harder to define what that actually is. A lot of these are unspoken rules, and even though it's easier to tell when someone isn't following them, it's harder to say why. So different examples of this, I've been given various different examples in Carlisle, for example, but it'd be things like someone pushing to the front of the bus queue and things like that, which is just not acceptable in British society. So what's good about this definition? Well, it's really, really easy to define between what is normal and what is abnormal. As I pointed out before, it is so easy to see when someone is not following these social rules. It has a social dimension to it, which not a lot of the definitions actually cover. So it's a more of a social definition, so that's quite nice. When you think of individuals who are suffering from mental disorders, it's kind of like all they're isolated, all they're sick in their head. So it's different from that stereotype that we have, so that's quite nice in terms of this social side to it. It helps people because we're able to intervene, so if we can see that someone's acting abnormally, if we can see that someone is suffering in that respect, then we can intervene and we can help as a society. And on the flip side of that, it also protects society. So if the behaviour is abnormal and is harmful, then it can help protect people from that abnormal behaviour too. And developmental norms as well. Actually, if we study atypical behaviour, it gives us quite a lot of information about what is normal. So if a a child is developing abnormally, we can see that, we can spot that, and we can try to correct that as well, which is also very, very helpful. And finally, the situational norms as well. So it considers the social influence of behaviour. It considers how abnormal or normal people are with their behaviour in that respect too. But there are criticisms to this, obviously. So the main thing is that there are like huge cultural differences, and that is referring to cultural relativism of what is normal in one culture is abnormal in the other. So I've got a little clip there. I do recommend you have a little watch. It is actually a video of someone throwing babies off the top of a building. So have a little look. Completely normal in one culture would be very frowned upon in the UK. It is also very subjective. So social norms are not fact, they are just opinions, and these change. They change throughout society, they change throughout history, and if that is the commonly held view, they can actually be used to control and suppress people who are seen as a threat. So 1984, as the book and the film, obviously, Peter, suffragettes, those sorts of things, like social norms can be used to oppress people, which isn't quite so great. They change over time, as I pointed out earlier, they do change. So, for example, homosexuality was not removed as a mental disorder until 1990. That is obviously quite shocking to a modern society, but like that is a fact. It was not removed from the diagnostic manual of mental health disorders until 1990. So until that point, it was it was considered a mental health disorder. Still some more criticisms for you. Individualism, so it might be that people who are different are not a problem, they're just individualistic, they're just eccentric. Know plenty of people who are eccentric and it doesn't do them any harm in that respect. And there might also be an ethnocentric bias, so ethnic minorities are overrepresented in mental health problems because of Western ideals of social norms. So for example, Cochrane 1977 found that more black people are diagnosed as schizophrenic than white or Asian in Britain, 7 times more likely, and obviously this bias is not found in Jamaica. So it kind of indicates that there might be an ethnocentric bias in that respect. So a little question to try out for you. One strength, one limitation of the deviation from social norms. So it's really important to identify what the strength and what the limitation is, and then you need to expand it. So this is the point where you can pause it and have a little go yourself. So 4 marks is what you're aiming for. Okay, so hopefully you've had a little go at that. So you're going to get 1 mark for identifying the different strengths and weaknesses, and the other 2 marks are going to come from expanding these. So as an example, social norms change over time, which means our perception of what normal is subjective. For example, homosexuality was not removed as a mental disorder until 1990, and that would be worth 2 marks. So you need something to that effect. You need to identify the strength and weakness, and you need to explain why is that strength, why is that a weakness. So the next one I'm going to talk to you guys about is failure to function adequately. Remember that this is defined as just an inability to cope with day-to-day living. So you're not able to carry out everyday functions that would be considered normal. So you wouldn't be able to wash yourself, dress yourself, carry out a job, etc. So those are considered to be normal things that everybody can do. So what's good about this definition? Well, it matches the sufferer's perceptions. So if you feel like you're struggling and you feel like you need extra help, this helps in terms of you actually wanting to go and find it, and people who want to find this clinical help. This degree of abnormality can also be assessed, so it means that we can see how abnormal and normal somebody is, and then therefore we can tailor the treatment to that, which is also quite important. Behaviours are generally observable, so if you're failing to function adequately, that these behaviours can be observed and they can be seen and they can be used in that respect, so it helps make the definition really objective. And to kind of link in with the degree of abnormality being assessed, that we can have a checklist. So we have a checklist of behaviours that we expect people to be able to carry out, and if people aren't meeting this, then that gives us a degree of abnormality, and normality also allows us a high rate of inter-observer reliability, so that ability to have several different clinicians looking at the same thing and all in agreement with each other. Personal perspective, which kind of links into the matches the sufferer's perspective, is that, you know, we're taking the person who's suffering, we're taking the patient's point of view, which is really, really important. Criticisms of it though. Abnormality is not always accompanied by dysfunction. So yeah, they walk among us, and I'm not even joking, because Harold Shipman, for example, he was a psychopath. He murdered at least 215 of his patients because he was a practicing doctor, but he was never seen as abnormal. Like, he was obviously not functioning properly, but never seen as abnormal. So it isn't always easy to spot. There's also the fact that the features of dysfunction are subjective. So the global assessment of functioning measures, they measure the level of functioning, but they don't consider the individual's perspective. So what's normal for one might be abnormal for another. And there's also times when it's normal for you to be abnormal. So if you suffer the loss of a loved one, it is normal for you to grieve. It is normal for you to show distress. But that is not covered by the definition. That would just be saying you're not functioning adequately and therefore you are abnormal. But to grieve, to suffer distress in that respect, that actually ultimately promotes healthy psychological functioning. Further criticisms, the behaviour might actually cause distress to other people, but it might not cause any distress to you. So if someone's saying that you're abnormal but you're perfectly happy, actually, you know, where do you go from there? So for example, we've got Stephen Gull, the Naked Rambler. You can see a little video about him there. He finds it perfectly normal to be naked out in the public, walking along out up in the hills and such, completely naked, causes distress to other people, but he's quite happy. There's also the fact that it can be rewarding to be abnormal. So this is kind of following along the lines of the behaviourist principles of operant conditioning, in that people might find abnormal behaviour rewarding and therefore it is exhibited more. So think people who belong to different social groups, so people who are gothic or vegan and that sort of thing. Sometimes people attach a lot of meaning to that identity and therefore they're quite happy to be abnormal. And then there's also the fact that, again, we're thinking about cultural differences, that what is normal in one may be abnormal in the other. And we need to consider this, that we can't really judge other people's behaviour in that respect. So I've got a link there talking about very British problems which would seem absolutely strange as anything in other cultures. So another apply it question for you. This one is a scenario. I've got David here. He's feeling quite low and his absences from work are starting to threaten his chance of promotion. He has sudden outbursts of rage, which are really scary, and yesterday he turned up to work with his hair dyed purple. What I'd like you to do is to explain David's behaviour by reference to the failure to function adequately definition of abnormality. So I want you to pick 2 points where he is failing to function adequately, and I need you to explain why that is happening. So again, pause the slides, have a little go at that. It's worth 4 marks. And here's a little suggestion of an answer for you. So if someone is failing to function adequately, then they are deemed to not be coping with everyday life, such as going to work, washing, dressing, etc. If this behaviour causes distress to themselves or others, they are deemed to be abnormal. David is functioning to function adequately because his behaviour is starting to affect his ability to work, as it is affecting his ability for promotion, and he is causing distress to others with his outbursts of anger. So that is a suggestion of one answer. That's kind of what you're looking for in terms of writing out a 4-mark answer. So moving on to our third definition now, we're looking at deviation from ideal mental health. It is defined as the failure to meet the criteria for perfect psychological well-being. Can probably see some of the problems with this already. So perfect psychological well-being would be not criticising yourself, like showing yourself unconditional love. Not everybody is able to do that, so therefore they wouldn't meet the deviation. They would meet the deviation from ideal mental health definition of abnormality. So some strengths of this, though, let's start with the positives. It is a very positive approach. For example, it is focusing on what is desirable and what is not undesirable. It is not the addition of negative traits, it is the lack of positive traits. So it's quite a positive definition, which is quite nice. It also targets areas of dysfunction. So if there's an area that seems to be lacking in somebody's life, we can identify this and therefore we can treat this, which is kind of what we're about in psychology. It's very holistic. So it considers the person as a whole, it doesn't just consider their problems, which some of the other definitions could be quite guilty of, in that we just see a person as a mass of problems rather than actually wanting to look at them as a whole entire person. It allows the patient as well to set goals, and it allows them to try and achieve these goals towards their ideal mental health, which is also quite good. It gives people something to aim for, gives people something to set for themselves. But there's quite a few criticisms, as you can probably imagine. The main one being, what is ideal mental health? You'd probably find that most people do not meet this criteria because it seems to be more idealistic than realistic. So for example, we've got Rogers, who says that stress is caused by the difference between our ideal self and our actual self. So if we've got that difference, then that's going to cause us distress, and therefore that's going to keep us in the definition of deviation from ideal mental health. But what's ideal mental health for somebody might be different for somebody else. Again, it is subjective, and you can make this criticism pretty much about all of the definitions we've looked at so far, because a lot of the mental health diagnoses actually rely on self-report, and some patients might just not have the skills to recognise that, and the doctors might not also have the skills to recognise that either. So it's a lot more objective to use physiological measures such as taking blood samples, for example, measuring brain scans, etc., etc., but you can't always identify mental health problems from that. So we're kind of stuck between a rock and a hard place. It's also contextual, so different behaviours are subject to the context that they are in. So if someone's staying in bed all day and not interacting with the world, then that's abnormal. But if they've just suffered the loss of a spouse, that's maybe considered to be slightly more normal. So you need to take it in context too. Some more criticisms for this one. Still cultural variation, and that is again something that we've looked at with the previous two definitions too. There's also the fact whether is autonomy desirable. So is it desirable to actually have elective decisions, to be individualistic? If you've got a culture which is collectivist, that might not actually view autonomy as desirable, and therefore this makes the definition culturally biased. So the last definition we're going to have a little look at today is statistical frequency. Remember that this is defined as behaviours that are statistically rare. You can see it there up in the corner with that most behaviours fall within that middle hump, and then the rare behaviours kind of come off to the side. So an example for this is IQ. So you can have people who are statistically very low in IQ, or you can have people who are statistically very high in IQ. So what's good about this one? It's actually appropriate to use this one in a lot of different respects. We can define so many different types of abnormality in this way, so that actually makes it quite a good definition. unlike all the others, it is objective. Once you have a cut-off, it is very objective that, okay, if you fall below this line, then you're defined as abnormal or you're normal. So it's very objective. And in addition to that, we don't have any value judgments. A lot of the others can feel quite judged based on morality in terms of our own personal beliefs, whereas this one, it's numbers. It doesn't hold any morality judgments. So for example, homosexuality is abnormal just because it is less frequent than heterosexuality, and the statistical frequency isn't making any value judgments on that. It's just saying this is less common than this one. It also provides evidence, so if you use this definition, then it gives us evidence to assist with mental health problems, which is also very, very helpful. And it's based on data, and we like data because, again, it is unbiased and it is objective. And finally, it shows us the whole picture. It shows us what behaviours are frequently occurring and which ones aren't. So it gives us a much more complete picture than maybe some of the other definitions we've looked at. We've definitely got some real life applications to this definition as well. So do we have to have certain measurements in place to diagnose someone as having a mental disorder? Yes we do, because we need to have some sort of assessment in order to measure people's symptoms and therefore to give them a treatment and to decide what is the best course of action for them. So, for example, how would you define depression? Like, how would you diagnose that with somebody? So I'm going to show you if you're not quite sure. So basically, if you are going to be diagnosed with depression, then you're going to be asked lots of different questions about health, how you're feeling, and how you feel you're coping with life. So there's different symptoms in which the GP will look for, and they will have a list of symptoms that they're looking for. So this isn't completely comprehensive, by the way, this is just some of them. So continuous low mood or sadness, having low self-esteem, feeling tearful, feeling irritable, intolerant of others, having no motivation or interest in things, making it finding it very difficult to make decisions, not getting any enjoyment out of life, feeling really anxious or worried, and probably the most extreme, having suicidal thoughts or thoughts of harming yourself. And this isn't fully comprehensive. There's physical symptoms associated to this, there's further psychological symptoms, there's further emotional symptoms as well, and we will look at this later on in the course. So you also have to ask whether most people feel like this the majority of the time, and the answer is not always. Depression can be cyclic, so this presents a problem for us as well. So what are the criticisms of this definition? Well, where do we draw the line? So it is not really clear where we should say, yes, okay, you have depression, yes, okay, you don't, because it isn't clear. It isn't clear where this should be a cut-off. We've also got the things that not all infrequent behaviours are abnormal, and some of them are actually desirable, like high intelligence. So that's an abnormal behaviour, but we praise this. So, you know, that can be a problem too. We've also got cultural factors. So what's normal in one country is rare in another. So things like eating horse meat in the UK is very rare, whereas in France it's very common. And this definition again doesn't take that into account. The other thing that can arise from all of these definitions is that once you label somebody as abnormal, this can have problems too. So we kind of have this moral debate as psychologists about whether it is actually a benefit to label somebody or not. Are they abnormal according to statistics, or are they abnormal because they're suffering? And this is a very difficult one, because if you've got someone who's labelled as abnormal, then this can actually have a very negative impact on their life, and they might be living a life that actually they're quite fulfilled and they're quite happy. So you see that a lot on the Undatables, and there's a little clip for you. The other thing as well though is that sometimes you need that label in order to be treated, in order to access resources, in order to access things that make your life easier or someone you love's life easier. So it's a catch-22. So do you accept the negative label and the negative things that come along with it, or do you accept the label and therefore you get the help you need? It's a tough decision. So there is